we are going to talk about symptom management. So what are our objectives today? We're going to actually introduce the topic of what is symptom management. How can we control our symptoms? Identifying signs for us, when to call the physician or when to call 911, how you can reduce your risks, which you'll notice in that list when we get to it. Those are things you absolutely have control of. And then the stop and go toolkit that we give you, we're going to review that. So let's start with symptomology of lung disease. So when we're looking at this list, with lung disease, you can have difficulty breathing. You can use a rescue inhaler. Your respiratory may increase. You may have a cough. You may have difficulty getting air in and out. You can have chest pain or chest tightness. All these things are symptoms of lung disease. What we are looking at is we want you to start recognizing what your normal is, what your everyday is for you, which is going to be different for everybody. And we start talking about symptom management is when and if you see an increase in these things. There's an increase of difficulty breathing. We always may have difficulty breathing, but now there's an increase. That's a change. Now I have to use my rescue inhaler more often than what's prescribed or what I normally have to do. So when we talk about these things, I want you to think about your shortness of breath. I want you to think about your cough. And these are things that we discuss with you in pulmonary rehab too. What is your normal? I normally have a cough and I do produce mucus, and this is what it looks like. That's my normal. And if there's a change in this, so increased mucus, now I'm getting more. Now there's a color change that's different for you. So we want you to look at what your normal is, and we review that with you in pulmonary rehab. Okay, this is your normal. Some things we may want to change, that we want to get to a more normal baseline. But if there's a change or an increase, that is what we're managing when there's a change. So identifying signs that are for you. So what's normal for you? Think about that. We ask you those questions when we first see you. We ask you, what are your normals? What does your cough look like? So now, do I feel different? Isn't usually the shortness of breath I have. If the answer is yes, and you have an increase in symptoms, when did they change? How long has this been happening? Many times with lung disease, we're kind of used to feeling the same symptoms every day, and I just kind of what we call, a normal for you. And so sometimes it's kind of hard to change or hard to identify when we have a change. So if you can, on your calendar, just a plain old calendar, just indicate however you want, smiley, straight frown face, 1 star, 2 stars, 3 stars, whatever you want to do for you, that today, this is a normal day. I was able to do the things I usually can. My symptoms felt the same. I have a smiley face. Maybe today it's like, no, it's not quite normal, but it wasn't bad. I just kind of felt a little off. Maybe that's a straight face. And then, no, this is a bad day. I feel like I have more coughing going on. I'm more short breath than normal. Maybe it's a frown face. And then if you use that or whatever system you want, but if you have that in the calendar, then when you look back at the calendar and you say, wow, I have a lot more frown faces than I thought, or a lot more straight faces. So when you actually call the doctor and they ask you, how long have you been feeling this way? You can actually look at your calendar and say, you know what, I guess I've been feeling that way for about 2 weeks. Or no, it's been a good week that I've been feeling this way. So it's very important to identify how your day is, because again, it can be subtle for you. And we may not recognize when it can be difficult to recognize when it's actually getting to be a flare-up. So when did it change? Very, very important to note. Okay, changes in symptoms, flare-ups. Flare-ups are a change from baseline. Okay, so whatever your normal is, when it's a change, that's a flare-up. It can be a new symptom. Maybe you never cough, and now all of a sudden you have a cough and you're bringing stuff up. Or it could be a worsening symptom where Yeah, I usually cough up, but now it's getting more difficult to cough. Maybe I'm able to clear it, but now I can't. So that would be a worsening symptom. Or if a new one, I usually never have chest tightness when I cough, and now I do. Often it's due to respiratory illness. You could be exposed to something, maybe with the fireworks going on, is a little bit more cloudy and hazy recently. That kind of irritated your symptoms. It can make you feel uncomfortable. And some of the flare-ups can be so uncomfortable that it actually you need to go to ER for it and actually be hospitalized so we can help you. So there's mild flare-ups and there's severe flare-ups. So we're going to talk about the difference between those two. So mild flare-ups. So these are an increase of shortness of breath. It's not bad, but I've been looking at my calendar now and I see some more more straight faces. You know what? I am more short of breath these last couple days. I needed my rescue inhaler more. I have more of a cough. I noticed that I feel more wheezy. That's a mild flare-up. That's when we call the doctor. If we're able to call the doctor and you get 2 days of feeling that way, that's why it's very, very important to indicate on a calendar how your daily symptoms are. Again, something very simple. I know you have enough to do with medications and all these things you have to do every day, but a simple little thing on the calendar keeps you managing your symptoms better and keeps you out of the hospital. I don't want you to think a hospital is a bad place to be. We need the hospital. We many times need the hospital, but if we can take care of it earlier and recognize it sooner, our chance of recovery is a whole lot quicker. And in the next slide, we're going to touch on that a little bit. So call your doctor, let them know. So when you call them, you're not going to give them a whole list of things. It started back in 1998 or whatever. You're going to tell them your baseline, and then you're going to tell them the change, because remember, they take calls every day from people who have changes in their symptoms. And so they don't know what's normal for you and what's not normal for you. So if you say, hi, this is Tracy calling. I feel like my breathing is getting a little bit worse. My normal is I use my maintenance medication. I use my rescue inhaler maybe twice a day. I do have a cough, but I'm able to clear it. And I'm able to do most things around the house. But lately, I'd say the last 3 or 4 days, or 2, if you're getting on it, last couple of days, I'm using my rescue inhaler like 4 or 5 times a day, and I'm hardly able to do any things that I used to do. And my cough, I noticed that my cough has really increased and I have a hard time getting it out. You tell them what your normal was and then your change. So now they hear there's a change, and you've just helped them speed along that managing process, because now you told them there's a change. You told them what your changes were. It's not your responsibility to know how to treat it. It's your responsibility to tell them, this is my normal. This is what I've noticed for a change. And then your doctor actually has time now to do something. They have time now to write you a prescription, to maybe get you in to see you, maybe add an antibiotic or something else. But now you've given them time to treat you and to manage you, and you're a crucial portion of that in that management. So severe flare-up, sometimes this just happens. So severe flare-up may include chest pain, blue fingertips or lips, okay, confusion, your family's recognizing that you're not quite right, you're kind of forgetting things, or you're really drowsy, like more than just fatigue. Or you have extreme shortness of breath or coughing. You do not hesitate. You call 911, because these are severe. These sometimes come out of the blue. Sometimes we can catch them. This is not where you sit around when there's chest pain or there's blue lips, and that's different from you, and you normally don't have chest pain. Remember, when we talk about all these slides, what is your normal? I normally have chest tightness. Is this a worse tightness? Is it a worse thing? Is it now pain? I never have chest tightness, and now I do. The difference for you. But if you have chest tightness, or you're getting blue lips, or you are confused and your family members are having a hard time keeping you awake, you go right to 911. That is exactly why that's in place. You need to get to the ER. That's exactly what you need to do. And we're sometimes our worst patients. So we need to make sure that we recognize the difference and get to where we need to so we can recover quickly. Okay, so now this slide is a little busy. Absolutely all valuable. Okay, there's one thing in here that I saw I wanted to make a special note over. But if you look at each of these things, all of these things, except for one line, you have absolutely control over. With lung disease, we many times feel that we don't have control. The disease process is controlling us. But you'll see in these series of videos that we talk about, you have control over how you breathe. You have control if you exercise at night, exercise or not. You have control over how you manage your symptoms. And many of these things, what we're offering to you or suggesting to you, are not difficult to do. It's just a change, and we have control over it. Quit smoking, maintain good air quality. We can talk about those things. We are there to help you with the smoking cessation. We are there to help you with how can we keep your house clean, because again, your lungs like a certain clean environment. Avoid exposure of pollutants or allergens. Sometimes that's a little bit more difficult. That's the one that I said it's a little harder because sometimes our environment doesn't allow us to have full control over that. But you do have control over some of that stuff. Lifestyle changes. That's a tough one to swallow. We have to actually change how we do things or how we're used to doing things, but you can do it. So when to talk to your doctor. This is the one thing I was kind of touching on too. So discuss the vaccines that we have and if it's appropriate for you or not, and other health conditions. Okay, so again, in the last slide I said you do not have, it's not your responsibility to know what's wrong. It's your responsibility to tell your physician when you have a change. Now we're just talking about lung disease. Many of you guys have diabetes, you have some heart-related issues, you have other things that you're managing as well too. So all of these things go across the board. You change in anything symptoms-wise for your diabetes, you would contact your doctor. You have change in anything heart-related, you contact your doctor. The same thing if there's a change in any of this stuff. So make sure you discuss other conditions that you may have with your physician, because speaking on the breathing topic, there are many reasons why you can become short of breath. You can be short of breath because of your lung disease. You can be short of breath because maybe your heart is not doing what it's supposed to do. You can be short of breath if there's an allergen. I mean, there's so many reasons. You can be short of breath if you're getting sick. There's so many reasons you can become short of breath, and it doesn't necessarily have to be related to your lung disease. So again, your responsibility to tell the doctor when you have a change of symptoms. Maintenance medications. So some maintenance medications can reduce your risk for COPD flare-ups. That's what they test them for. So taking them on, that's going to be one video that we do too, or that we've done. Taking your medications on time. Are they working? We'll discuss that all in that video. Washing your hands. Number one way still to prevent infections is washing your hands. And because we do it so often, we don't really pay attention and we touch our face. Your body has only so many holes to get in, okay? Your lungs are the only organ. We're just gonna keep going. My light shut off. We're just going to keep going. I might record this video, I might not. Your lungs are the only organ that's directly exposed to the outside. So that means everything you breathe in, anything you touch in your mouth, anything you touch for your nose or anything like that directly goes into your lungs. So please pay attention and try not to touch your face. Hand sanitizer. Can't wash your hands? We have hand sanitizer. Okay, so I believe this is our last slide. So our stop and go. Our stop and go action plan is, it's a tool, and there's a couple different tools. Diabetes has this tool, asthma has this tool. There's a couple different tools out there, but they're all very, very similar. The green zone is what's normal for you. You're normal. So we have listed a few things in here that may not be your normal. These are just examples. So you would put your normals in here. You could pencil them in there. You can, maybe they change. Whatever your normal baseline is. I do have a daily cough. I do have mucus that I cough out, but it's clear. That is your normal. Yellow is a change of symptoms. This is your mild area, your mild flare-up, okay? So I now have a fever, I have chills, I have an increased cough, I have an increased swelling, I have an irregular heartbeat. Anything that's a change or a flare-up or an increase or new symptom, that's your yellow zone. That's where we call the doctor. That's your mild symptoms. We don't mind yellow. We go green to yellow often. But if we go back, if we stay in the yellow, okay, and we manage it well, it's very easy to go back to the green, okay? So the red zone, that's our severe flare-up. That's going right to calling 911 and going to ER. So if you are able to manage your symptoms and you stay on top of it, the more you're able to stay on top of it and stay in the yellow and go back to the green, the greater your chance of keeping your lung disease progressing slowly. The way we increase our lung disease, or excuse me, increase the progression of the lung disease is frequent infections. So we can't help sometimes if we get an infection. Many times we can help if we get an infection. If we change our lifestyle, we work on our risks for getting an infection. But the more lung infections you get, and they say if you get more than 3 a year, and that's a flare-up, the progression of a lung disease is what it progresses faster. So to slow that progression, exercise, eating right, and symptom management slows the progression of your lung disease. And that's our goal. So green, normal symptoms, your everyday symptoms, that's what you have for your normal baseline. Yellow is a flare-up of symptoms, mild, and then red is the severe. And that's when we go right to 911. All right, if you have any questions, please jot them down. Share with us when you come to pulmonary rehab those questions. You can always call us too, but let us help you be part of the management team with your doctor to help manage these symptoms.